Good afternoon, everybody. Welcome to this afternoon's TBI Talks webinar. I'm Ian Mulhern. I'm the Exec Director for UK Policy here at TBI. And I'm so delighted that so many people are joining us today, our panelists, but also attendees on what's been not exactly a quiet news week. And I understand there's more news just breaking, so even more grateful to you for spending the next hour and a half with us, and that's testament, I think, to the importance and the scale of the challenge that we're discussing today under the title of Lives versus Livelihoods, the economics of controlling COVID-19. Now, there's obviously been huge controversy this week, particularly with the vote around the economic consequences, particularly of the non-pharmaceutical interventions, the suppression measures that the government has introduced under a second lockdown. And we know from lots of people, many of the people we're about to hear from have been involved in doing cost-benefit analyses from the spring lockdown, and some of which suggest that the lockdown approach doesn't necessarily add up in terms of costs and benefits. But others have highlighted the importance of thinking about the impact of the spread of the virus and what effect that plays back onto the economy, and how we should think about the question from that perspective. Yesterday, the Chancellor told the House of Commons that there was no current prediction or forecast of the economic effects of the measures that have just come into force, and so that begs a few questions for us today that we want to get into. Is there a trade-off between the economy and the spread of the virus? How should we think about the costs and benefits of suppression measures like the lockdown? How is the economy likely to fare if case numbers rise or fall or change in some way? And what kind of analysis should the government be doing, and where should that sit? And I'm sure we will get onto many, if not all of these questions, and probably more in the next hour and a half as we tackle some of these things. Now, the format today is an open roundtable format. We've got an audience of people listening in. Those of you on the call listening in can type questions as you go into the Q&A box, and I'm hoping that those of us around the table will pick up some of those questions as we go and answer them. And the conversation will be mainly between those of us on the screen at the moment. In the interests of time, I will briefly go around the table and introduce everybody so that we don't take up too much time. We're going to hear, in no particular order here, we're going to hear from Nancy Hay. Nancy is the Executive Director of the What Works Wellbeing Centre and the author of a paper in the spring taking a wellbeing approach to analysing costs and benefits. We have Tim Loynig, who's an economic advisor to the Chancellor. We have Professor David Miles from Imperial College, and David authored a paper recently called Living with COVID-19, Balancing Costs Against Benefits in the Face of the Virus. We have Barry McCormick. Barry is the Director of the Centre for Health Service Economics and Organisation at Oxford University, and previously was at the Department of Health. Francis Coppola, who is an economist, author and commentator. Lord James O'Shaughnessy, former advisor to David Cameron and former permanent Undersecretary of State at the Department of Health. We have Professor Jonathan Portes, Professor of Economics and Public Policy at King's College. Dr. Flavio Toxford, economics lecturer at Cambridge, and Flavio is at the cutting edge of some of the work to integrate economics and epidemiology from the academic side. Tony Yates. Tony is the former Bank of England economist and former professor of economics at Birmingham, and he's been making the case very publicly, many of you will be aware, for a centre for epidemiology and economics to inform this debate. We have Chris Cook. Chris is familiar to many of you, as a reporter, analyst, commentator at Tortoise Media. And we have Giles Wilkes, an economist and former advisor to Theresa May at Number 10. We should be joined in a few minutes, I hope, also by Martin Sambu, economics commentator at the Financial Times. So I think I've got everybody and introduced everybody. So we will crack on with the topic at hand. So if I could just kick off, then I'll invite first David, if I could, and then we'll go to Nancy, and then we'll hear from Tony before we get into wider discussion. David, over to you.
Thank you very much, Ian. I'm going to be brief and make some very simple, possibly even simplistic points. The first is, and I think it's something that is uncontroversial, which is that there are no easy answers to what the right government policies are in the time of the virus. That's particularly true in the UK, given where we now are. I think one of the reasons why there are no easy answers is that there are likely to be trade-offs. In other words, the policies that might be most effective in quickly bringing down the rate of infections and minimizing likely deaths from the infection may well be policies that have substantial costs elsewhere, and that's almost inevitably going to give you a trade-off. Having said that, there are plenty of people now who say there are no trade-offs. I heard Sir David King, eminent scientist, I think formerly chief scientific advisor, not economic advisor, chief scientific advisor to the government, simply stating as a matter of fact that there was no trade-off. Jan Vlieger, who actually took over my place on the Monetary Policy Committee at the Bank of England when I got to the end of my term, made a sort of similar point with at least some evidence in a speech he made a couple of weeks ago. Of course, if there are no trade-offs, that doesn't mean that there's an easy way forward, but it actually makes policy easy, because if there are no trade-offs, why wouldn't you follow the policy that most rapidly brings down the rate of infections and keeps it at that very low level, a policy of extreme, what you might call extreme suppression? And if there are no trade-offs, then why wouldn't you do that? Of course, I think once you put it in that way, the idea that there are no trade-offs seems almost entirely implausible to me. We know that it's highly uncertain when there might be a vaccine. There may not be a vaccine until well into next year. There may not be, even after you discover a safe vaccine, a point at which you've got enough cases of the vaccine to distribute amongst the population in the UK until the end of next year. So if you thought there was no trade-off, and you thought, therefore, that the optimum policy must be to suppress the rate of infections and keep it as low as you can, you might need to be doing that for 12 months or longer. And the wider knock-on effects of that, and I don't simply mean the effects on GDP, I mean the effects on welfare, because in any kind of cost-benefit analysis, it's certainly not lives against GDP. It's some aspects of the welfare of the people of this country versus other aspects of the welfare of the people of this country. One indication of the difficulty of those kind of trade-offs, I think, came up very starkly for some research recently done by one of my colleagues at Imperial College, Carol Proper, very well-known health economist, who, with some other co-authors, has just published, I think, a very careful study of some of the longer-term health costs of economic shocks. And her work would suggest that the scale of job losses or employment declines after the global financial crisis, 2008, 2009, the scale of those employment reductions was such that their central estimate is that it increased the number of people in the UK who had long-term chronic health conditions by 900,000. That's 900,000. That was their central estimate. And the employment costs of that we are seeing right now in the UK are likely, I suspect, to be on a scale equal to and possibly greater than the employment losses back after the financial crisis. So some people would, in defense of the proposition that there isn't much of a trade-off and therefore we should be guided by scientists who are focusing quite rightly simply on what would you need to do to bring down the infection rate most rapidly. Those who still stick with this argument are quite fond, I think, of showing pictures where you look at different countries and you have the GDP hit so far in 2020 on one axis and the number of people who are estimated to have died as a result of COVID on the other. And the dots are all over the place. And it isn't the case that those countries that have had the least restrictive policies, and therefore you might expect the least hit to GDP, are the ones that have the highest death cost. It doesn't look like that. I think there's a rather excellent, very recent, in the last 2 weeks, paper published by the NBER by Charles Jones and another author, which explains why those kind of graphs actually are hopeless in answering the question, what is the nature of the trade-off? Briefly, it's that there are so many other factors going on. When did the virus arrive in your country? What's the density of population? How many people are obese? What's the age structure? I mean, it just tells you that those kind of pictures, which you sometimes see now appearing, I don't think tell you much about trade-offs. Very briefly, let me just finish my comments. Firstly, just to say that the attempt I made a little while ago to assess whether the 3-month lockdown we had in the UK, starting back toward the end of March and really being eased fully during the course of early June, was an optimal policy, suggested at least that probably that lockdown was kept in place longer than would have been justified by plausible estimates of the number of lives saved versus estimates of the wider costs, also in terms of health and livelihoods. That doesn't tell you for one moment that a short lockdown right now, when we've seen obviously infection rates rising very sharply, is obviously a bad policy. I think that depends on how long it's kept in place and what the strategy really is in the longer term, which is not entirely clear. If I could finish very briefly 1 minute with one observation on the nature of decision-making that it seems to me is happening in the UK. And I say this as an outsider, I'm not part of any actual decision-making in this area. It seems to me that there's something of an asymmetry. There's an asymmetry in the sense that the scientific advice, mainly coming from SAGE, is focused quite rightly, given the nature of SAGE and the people who are on it, who are epidemiologists largely, on the question of how one might most effectively bring infection rates down and minimize likely future deaths as a result of COVID. And indeed, I think SAGE itself accepts that it is not looking at wider costs. If I can briefly quote something from the SAGE minutes of their conclusions on the 21st of September, which was that there should now be what you might call a short, sharp lockdown in the UK. And they say, the evidence base into the effectiveness and harms of these interventions is generally weak. Nevertheless, non-pharmaceutical interventions will need to be in place for a considerable period of time. And it's important, therefore, that studies are undertaken to evaluate the risks of different settings and the impact of different control policies. Suggested analysis would include studies on the impact of harms of these interventions. Policymakers will need to consider analysis of economic impacts and associated harm alongside this epidemiological assessment. So what they're saying is, we don't do that on SAGE. That's not our job. We don't know about that kind of stuff. We're pretty sure you'd have a short, sharp lockdown. I am not saying that's obviously bad advice. What I am saying is it's very strange. You don't normally get scientific people, and you certainly don't get doctors saying, here's a treatment. I think it could have some very unpleasant side effects. I don't know what they are. Maybe somebody else could look into that, but I'm pretty sure it's what you should do right now. It seems we've got into a rather strange position where that's what's happening, and that's the advice that's feeding into government. Thank you.
Thanks, David. And before I move on, David, what do you make of the IMF's analysis, for example? There's been several attempts at this kind of thing, but the IMF's analysis back in the World Economic Outlook, which suggested that the majority of the reduction in activity, or at least mobility, in developed advanced economies was down to people voluntarily changing their behaviour, which
yes, I
suggests
don't
know. The lockdown, the net effects of the lockdown weren't actually that. Sorry, go on. What do you make of that?
Well, as applied to the UK, I think there's obviously something to the argument. It was clearly the case before we actually got to March 23rd, when what you might call the true lockdown began, the tight lockdown, that people's behaviour had begun to change. Partly it was in anticipation. The government was giving plenty of indications that it was likely to be introducing restrictions. And so there was some clear evidence that people's behaviour was changing ahead of that. It strikes me that it was very implausible that people's behavior would have been the same if the government had simply said, be careful, wash your hands, avoid crowded indoor spaces and such. If they'd simply done that, then we would have just got the same outcomes in terms of people going to work and moving around outside. After all, the government did say, do not leave your house. And the idea that saying do not leave your house didn't then have some very substantial effect, and indeed don't open most shops, on activity, seems to me, almost literally incredible. For what it's worth, in the cost-benefit analysis that I briefly mentioned earlier, we certainly did not assume that all the dramatic fall in GDP after the lockdown came into place was all a result of the lockdown. In fact, I recall, I think from our estimates, we put something like 50 to 60% of it may have been due to the restrictions, but a very substantial change in activity would have happened simply as a result of people responding to things they were scared about. Yeah. Of course, their degree of fear was itself a response to what was being
what they were hearing. Yeah.
They were told, yeah.
Okay, great, thank you. Nancy, can we go to you?
Hi, yes, I'm Nancy Hay. I'm the Exec Director at the Work Centre for Wellbeing. And I'll start by saying that if the aim of government is to improve social welfare or well-being, how do we know that it's doing that? And then within that, what is the role, what's the impact on the economic part of our lives, and what's the role of economic policy in inclusive and sustainable rises in well-being within that? And if I'm talking about well-being here, I'm talking about how we're doing as individuals, as communities, and as a nation, and how sustainable that is for the future. And that's particularly important for this economic. We usually think of that in environmental terms, but we're thinking about this in terms of the economic impact here. And this means looking at distribution. It means looking at fairness, so the difference between top and bottom, but it also means difference between different groups. And I'm conscious of that in this forum that we're talking about, of the different groups and the differential impact it's having on different people. And also the very bottom minimum. So is there a minimum level of quality of life for people? I'm also talking about looking at a broader range of data than we may normally do. So, this picks up some of the not my GDP conversation in the distributional analysis, but also, do you feel better off and are you better off? So the difference between objective and subjective measures and the use of those in policy making. So you may be objectively safe with whatever PPE you've got, but do you feel safe? And so those different measures are important. And actually that's interesting when we're thinking about some of the impacts that we saw earlier. And potentially we should be looking at some of the disaster impact literature and the impact that had and how that feels, because that's actually more akin to what happened in Italy and potentially New York and Wuhan. And then also looking at how those measures and impacts fit together across the piece. And so, and how you feed those into policy making. So how do you look at a broad range of measures? This has clearly hit multiple impacts of our lives, our working life and what we do with our day, our social interaction and our community well-being, and our health impacts very broadly. So not just the COVID related ones, but the health and mental health related ones. And we prioritize using life satisfaction, and that's actually asking people how they actually feel. And this is where you get some really interesting effects. So we see the top drivers of that life satisfaction at an individual level are mental health, physical health, together, and that mental health impact we can map. And actually we've been surprisingly resilient. We get used to lots of things, but actually for those people who've got long-term mental health issues, actually their experience has been really bad in this, that the cost is very high for them of a lockdown. And then we can also look at social impact in terms of our personal relationships, where this is a particularly, what kills this virus is loneliness, and so this is tricky. And so we're looking at our individual relationships, our community relationships, and nationally our trust and our social relation, our sense of, and that affects how well we comply and our confidence in how this is being dealt with. And one of the big drivers we see of that social trust is both competence, but also the ability to think ahead and predict and respond appropriately, which is again why the disaster recovery work is particularly important. And then lastly, the third biggest driver of adult well-being is economic, and actually it's jobs. And unemployment is one of the areas where we see a long-term scarring effect. And it was one of the ones that really switched me over to this way of thinking about how we're doing, because some of the well-being findings are fluffy, but actually this employment one is not. And it's one of the strongest and most and biggest findings in the literature, that if you are unemployed for more than a year, it has a long-term scarring effect. And the quality of that job that you move to, re-employment helps, it can recover and bounce back, but the quality of that job that you move to matters. But that long-term scarring effect is important, and David talked a little bit about this at the beginning, but it can lead to quite big health inequalities that affect our resilience in the longer term, and actually it brings down the age at which you potentially are susceptible for the virus and other things like that. So there's a whole range of things that you can then look at, and then we can see that in terms of the cost of the lockdown overall. And the question then for me is, when does the suppression measures stop being overwhelmingly beneficial? And so the length of the lockdown is important, and if we're going to do it, you need to do it properly and make sure it's effective, because the cost is quite high. But you can see some of the things that we learned from the first lockdown coming into effect in the second one. So for those of people who are living alone, or being able to spend time outdoors or in a crowded environment, being able to spend time outdoors, being physically active, which we know makes a difference, engagement with green space makes a difference. All of these sorts of things can help as well. And then lastly, it's about how does that advice come into government, and how does it get put together? So there's no department for wellbeing. Actually, arguably, Treasury is a line department in this. It's got an economic policy role. And so where does that advice come in? We've got excellent committee on dealing with the epidemiological advice and how we look after the impact of the virus, but how does all of that other impact come in, and how does it put together, and how do we make those decisions and weigh it up, and where does this take place? And I certainly think the impact assessment process that we used to have doesn't do that and didn't do that, but there must be ways in which we can come together to look at these costs and effectiveness, costs and benefits over the whole thing. And see the evidence on which that is based, and which the work centres have a role to play as we build and learn the knowledge as quickly as we possibly can. And all of them, I think, do NICE and others as well.
Thanks, Nancy. One of the points that I think both you and David raised is about how GDP isn't everything, or even necessarily even most of what we should care about here, and that's a point that's very well made. But I wondered, in terms of the really big call about whether you lock down or not, does a well-being perspective, I mean, is GDP a useful proxy for the wider well-being situation, given the relationship particularly with unemployment and that sort of thing, or do you think it might lead you to a different conclusion on whether and when to lock down, and for how long?
So the other measure that's traditionally used as a proxy for societal welfare is life expectancy, and actually we need to think more broadly about that measure as well, although life you need them both alongside. I think the tricky bit is that what is it that matters about the economic bit of it? Is it jobs and livelihoods, which was interesting to see that language change. My holiday is somebody else's job, and actually the tourism industry has affected whole places and whole communities in a way that they may not easily recover from, and we know that from other historical shocks where big employers leave a town or whatever. So we can learn quite a lot here from history. At a national level, GDP becomes the fifth biggest driver of overall well-being. So if you look at the top high well-being nations and the bottom well-being nations, the four things that make a difference. So healthy life expectancy, GDP at the bottom are 5 and 6. You've got social trust and having somebody to rely on in times of trouble, and the strength of civil society actually are much stronger drivers. And so I think our social capital is the bit that helps us bounce back, and we need to look after that very well.
Okay, great, thank you. Tony, let's go to you.
Thanks very much. So as Ian introduced me earlier as having intervened in the debate already in public, in particular in an article I wrote in The Guardian, and subsequently at a Treasury Committee hearing a week or so ago, to make the case for a new quango. It doesn't sound like a terribly promising idea when I describe it like that, but which would be called something like the Center for Epidemiology and Economics, and it would have as its job to publish regular forecasts conditioned on a menu of alternative policy measures, including things like lockdowns and their subvariants, with MPs or the government subsequently deciding on what to do about it. And so I propose that really for reasons that both David and Nancy have already told you about. Both of their talks are about that same thing, which is that the way things have emerged at the moment, there's been an apparent siloing of the advice, the public health advice and the economic advice on the other hand. So, going back to March, we had the early SAGE forecasts using a model with lots of demographic detail in terms of how people contact one another, but containing no economics, no tendency for people to adjust their behavior as health risks evolve and the virus spreads. And as a result, not getting the right answer in terms of the likely health impact, the number of deaths. And on the other hand, one presumes economic advice going on inside the Treasury. David read out that nice quote from the more recent SAGE meeting on the 21st of September, where they recommended that economic advice be considered alongside what they had recommended. And I suppose what I would like to point out is that ideally this thing should not be considered alongside it at all. The two things should be considered in an integrated framework, an integrated model of both the virus and the people that carry it. So Ian introduced Flavio, a fellow panel member, and he has been initially, I think, rather lonely at the frontier of this literature, and now it's become much more of a crowded field as other economists have started to get in on the act and join familiar, initially very simple, and then more and more realistic macroeconomic models with simple models of epidemiological models that are the ancestors of the more sophisticated and detailed models that SAGE use. So as I read this literature, it seems to conclude across its many variants that at least in principle, there is such a thing as an optimal suppression strategy involving a lockdown, transiting to test and trace, sometimes people looking at the emergence of a vaccine. And pursuing that policy leads you to conclude that there is, in fact, in those model worlds, no trade-off. That relative to not doing anything at all, one can improve both the number of people who lose their lives and GDP, and if one were to enrich it with other aspects of well-being, which people typically don't, but one can imagine how one would do that people will be better off as well, relative to a world where you simply let the virus go. Also, I think, although I haven't seen this experiment done explicitly, but I think having taken one of the simpler models to bits and put it back together again myself, along the transition path from seeing the virus emerge, deciding to do something, and then implementing what at that point would be an optimal lockdown strategy, you would in fact observe a short-run trade-off. So as you lock down the economy, you will lose income, people will lose their jobs, and so on. So there will be short-run pain before the long-run gain that you achieve, which is keeping in mind the counterfactual of letting the virus go and allowing COVID to become a permanent feature of our lives and the economy. So at least insofar as those models capture the world, and one can argue about how well they do, there is such a thing as an optimal lockdown strategy. It can improve everything, but along the way, it will look like you are indeed suffering and experiencing this short-run trade-off. And what, maybe why the politics of this is so difficult is because of that that short-run suffering, or indeed what is a short-run trade-off, again, at least from the perspective of the model, is misperceived as a long-run trade-off. So one naturally wonders what economic advice has been going on in the Treasury. And the other unsatisfying and worrying thing about the situation is that not only has the advice been siloed, but one part of it has been put very, very much in the public domain and subject to lots of scrutiny, code taken apart by lockdown skeptic software engineers, whilst the economic advice has been entirely in private. So this has become more of a feature of the public debate recently. So when the government initially refused to lock down following the advice on the 21st of September, it was reported in the Mail, I think, that the Chancellor had, in quotes, ordered officials to publish the advice that they had given him and that he had agreed, that in fact a lockdown was too costly. Now, we have just begun a lockdown, which is somewhat perplexing because, insofar as there were costs, I assert, based on my reading of the applied macro epidemiological literature, that these aren't long-run costs, they're short-run costs. But insofar as there are short-run costs, they will have gone up. So whatever analysis was done that led the government to conclude that a lockdown was not advised after the 21st of September must surely have got worse since then, because we would, as is blindingly obvious, if you let the prevalence rise significantly, you're going to need a longer or tighter lockdown to get back to a situation where your test and trace capacity, such that it is, can suppress the virus subsequently, which is going to cost you more. So that makes it very puzzling indeed as to what it is that went on behind closed doors in the Treasury or elsewhere in the government that was responsible for producing that economic advice. And it's highly unsatisfactory, I think, when the stakes are so high that this is allowed to go on in private, because my strong suspicion is that privacy is taken advantage of, probably, not to do terribly much by way of sophisticated analysis, and to let the thing be decided by politics. And if one had an institution such as I was proposing, the finer details of it are neither here nor there really, but if it was taken out of the private domain and put in the public domain, it could be much more easily scrutinized, and there would be no temptation for politicians to simply shove aside economic advice. And one has to realize that the economics is not settled. I disagree with David's conclusions on the lockdown, but as a long-time colleague, I respect him and read all of his papers assiduously, and I would want views like that to be very much on the table and pulled in a public way into that kind of format. I'm feeling like I've gone on for too long already.
Thanks, Tony. Yeah, before I open it up, just have you, whenever, from everything I've heard from, for example, the Health Secretary, who seems to be much more on the part of the government that's pushing more towards lockdown, or for the measures that have just come in, he very much couches it always in terms of the health cost, the COVID health costs, and there's no real appeal to that. No one in government seems to make the case that you suggest they've implicitly understood that something has changed and that there's a feedback effect to worry about. Do you think that this kind of thinking that you've been talking about is understood in government? Have you seen signs that it is that they do think about it in that way, or is it just not on the agenda in the Treasury or anywhere else?
I haven't detected anything through my own personal networks, and I haven't seen anything except insofar as ultimately what the revealed behaviour is. So somebody at some point has buckled, albeit too late, both in March and now, and concluded what I think is essentially the right thing, which is that we should attempt to suppress the virus. Especially if you're comparing the decision between now and March, given that the prospects for a vaccine are so very much brighter, it ought to have stiffened the resolve that it was worthwhile doing it. So no, except insofar as what they've ultimately done.
Yeah. Okay, great. Let's go, Flavio. Should we go to you next?
Sure. Can you hear me? Yeah, great. Yeah. Okay, so let me just start off by thanking everybody for being here. I think it's wonderful, given my particular expertise, that this is giving so much attention, and I think that's wonderful, and I welcome everybody to the field, as it were. Let me just make 2 points. The first one is that I think it's gratifying that most of us seem to be in agreement that we need, in order to formulate optimal policy, some kind of cost-benefit analysis. I think in some quarters that would already be controversial, but I think it's inescapable that we need some kind of consideration of what are the costs and the benefits. Now we can then quibble about what are the right inputs and what are the right parameter values that go into this analysis. I have my particular doubts about some of the more recent ones. I think we are grossly underestimating the costs of easing restrictions, but we can come back to that later. But I think we can all agree, so kind of as a big methodological point, that this is probably the right way to go, some kind of cost-benefit analysis like the one that David has been engaged in. Now, the second thing I'd like to just raise is this point of trade-offs. I wrote a piece for the Economics Observatory back in May. I reread it recently, and I'm happy to note that I'm not embarrassed about what I wrote back then. And it was exactly about what are the trade-offs we face in this situation. And there are trade-offs. If there were no trade-offs, then economists would have nothing sensible to say to this debate. I mean, this is what our bread and butter is. Now, the question is, what is the nature of those trade-offs? And I'd like to pick up on something that Tony suggested, which is that there's a time dimension. There's a short term and a long term. There's a difference between what we do at the very short run and what we do in the long run. So in the very short run, it might actually appear as if we're sacrificing the economy on the altar of health. But I think the way to think about it is that if we don't suppress today, we are going to have more infection tomorrow, and therefore we're going to have no economy to speak of tomorrow. And so it's really it's a temporal trade-off. And so what we do today in closing down the economy is, you could think of it as an investment in improving the future path of the infectious disease. So really the key here is to think in terms of dynamics over time, and it's not enough just to look at what is the cost of the lockdown today, what are the lives saved over the period of the lockdown. You really have to think about what are the long-term influences on the evolution of the epidemic, and what is the costs and benefits of those dynamics. And there are 2 costs of not suppressing sufficiently today. One is, of course, there's the direct impact on health today. But the other one is that by in some sense, making the evolution of the disease worse, it means that we will be forced to make additional restrictions in the future, which will then also have an impact on the economy. So it's not just the economy today versus health tomorrow. It's really health and economics today versus health and economics tomorrow. So I think there are certainly also short-run trade-offs we need to understand. For example, what is the least cost way of getting the reproduction ratio down to some specified level? There are some activities that do not contribute to infection at all. And so those would be completely pointless to restrict. There are others that have very little economic benefit, but they contribute greatly to disease transmission. So these are clearly short-run trade-offs, but this is really a different kind of trade-off than the one we are talking about here. And I don't think that the people who say that there are no trade-offs really are advocating for either laissez-faire or for a complete lockdown. I think it's a little bit of a straw man argument.
Thanks, Fabio. That's fantastic. Who wants to dive in on that? Let's open out a bit further. Someone want to comment?
Can I just say one thing? I mean, it may be a straw man, but it's absolutely what many people are saying. I mean, Sir David King said there is no trade-off. He's former chief scientific advisor to the UK government, and he was talking to the UK government, or trying to.
Francis, do you want to come in?
Yeah, I wanted to pick up Flavio's comment about short-term versus long-term, because it seemed to me that actually even everything Flavio was talking about was more short-term versus medium-term, because I want to kind of gaze into the distance and see the way in which the virus, whether we suppress it or not, actually, is reforming and reshaping how our economy works, and that's because of its sectoral impact. So particularly hitting certain types of service industry, for example, and it's very hard to see how those services can come back in their previous form. And it's even harder to see what they'll look like in the future. So it seems to me that we have to consider not just whether we should or shouldn't suppress the virus, but actually, in a way, whether we do or we don't. What's our economy going to look like kind of 10 years from now, and who are going to be the losers, who are going to be the winners, and in a way how we think about the path of GDP and of all the other things that Nancy mentioned, for example, over that time period. I mean, kind of looking back on the effects of the financial crisis and seeing the way in which the path of GDP, for example, ended up being very different from what we thought it would be, where we all thought it would bounce back onto the previous path, and it didn't. It seems to me we're facing the same kind of fundamental structural impact here, and it would be useful to try and look into, at least try and have some idea what future paths might look like, and where the costs will fall.
And Francis, does that lead you to any? I mean, does taking a much longer term perspective lead you to a different conclusion to if you were thinking about the short versus medium term that Flavio was talking about?
Yes, it does slightly, because I think we have to. It sort of touches on, in a way, what makes us human. Which sounds very deep, but if you look at how the virus attacks us, it attacks aspects of our humanity. And I'm actually very disturbed by some of the rhetoric I'm hearing around the idea that, for example, you can, as a long-term strategy, lock away people who are vulnerable and just let the virus go into the community and move around. And I've heard that suggested as a long-term strategy. For me, it's just not viable at all, because the social consequences of that are so very great. So I don't think you can really separate out sort of short-term things from the way in which the long-term effects and the kind of changes, structural changes you might see in society as a consequence.
Okay, great. First of all, hello, Martin, welcome. Good to have you with us. First of all, I'll go to Jonathan, and then Martin, I'll come to you, and then Tony, I'll come back to you. Jonathan.
Thanks, Ian. I just wanted to follow up on Tony's point that the problem is not that you have economic advice and science advice and they're not given equal weight. It's they're not integrated properly, and to strongly endorse that and just give a couple of examples. First of all, statutory sick pay, which I wrote a piece about today. There is no calculation that I can make that does not suggest that having a much more generous sick pay system would not be good value for money in economic terms, in terms of reducing infections, even before you get to the welfare and health costs of reducing infections. Why have we not got that policy? My only assumption is that that policy is made in DWP and most of all the Treasury, and not by the scientists, and the scientists probably haven't been asked to it. But to make a proper assessment of the impact of SSP, you need both to consider the health and epidemiological implications of changing it, but also the sort of standard labor supply elasticity and behavioral impacts of changing financial incentives that actually basically is what labor economists do. And as far as I can tell, that has not happened. And that's why we have a clearly suboptimal policy. Similarly, I was on a similar event this morning from the Institute of Government, where somebody from SAGE said effectively that nobody on stage had been consulted or asked for advice in any meaningful way on Eat Out to Help Out. Now, I don't know whether that's true, but the implication was that Treasury had made this policy as an economic policy, taking into account the economic costs and benefits of giving a tax incentive without considering the impacts on the course of the pandemic. If true, that is simply bananas. And that's without saying whether a different decision would be made. I'm not going into the evidence on what Eat Out to Help Out may or not have done. But the idea that that's what, that we are making, that there is economic advice coming from one side, the Treasury et al. To ministers, and then scientific advice from the other, and that somehow ministers are supposed to do the integrated macro modeling in their heads, or their private offices are doing it, rather than have people like Flavio, Tony, and their more quantitatively literate health counterparts, Barry et al., doing it, seems to me to be a real policy failure in this sphere. So that's my first point. Just want to make concrete why what Tony and Flavio are talking about really, really matters, and why it's primarily, without denigrating the sort of stuff that David and others have done, Gus, for example, I really don't think that sort of stuff helps us very much at this point, whereas an integrated approach potentially could help us a lot. My second point, going back to something Nancy says, is about the sort of this long-term stuff, and with, tangentially addressing some of the points Francis made. Yes, medium to long-term, what matters is unemployment, morbidity, life satisfaction, all the rest of it. I don't disagree with that, but that's fundamentally about getting policy right after this, in my view. And I think we may go down the wrong route if we try and integrate that too much now, because it's too general, too vague. If you want to reduce mortality in the short run, having a nice sharp recession is actually a really good way of doing that. Carol Proper doesn't mention that, as far as I can tell in her piece, but actually we've got pretty good evidence that short term, 6 months to 3 years, having a nasty recession will increase life expectancy, right? Do we think that's a good reason? No, we don't. But I think it tells us that, we should be worried about things like the long-term impacts of unemployment and health conditions, but that is about getting policy right for the recovery. It's not necessarily about getting policy right now. I'll stop there for the moment.
Okay, great. Thanks, Jonathan. James, if I come to you first, and then I'll go to Martin, and then Chris has asked to come in. Tony, I'm going to leave you for a bit. James, over to you.
Sure. Thank you, Ian. And first of all, given that you and I were discussing this topic on a phone call 2 or 3 weeks ago, I'm delighted to sort of uncover this treasure trove of thinkers who have been thinking about this so deeply. And I can't emphasize enough how important it is that we are having this conversation as a group and having it in public too. So that is some sort of progress. So I've been thinking about this from the point of view of a sort of a policymaker, but also thinking about the politics of it, especially given the debate in the Commons on Wednesday ahead of the new measures coming in. And it seems to me that there are 3 ways in which policy making could be improved in terms of COVID response. And indeed, these are in effect the sort of de facto conditions, I think, that are going to guide future policy making, particularly when the Commons comes back to look at this in about 4 weeks' time and looking what future measures might be involved. The first is really to pick on something that Tony said, which is about transparency. I think the lack of transparency from the beginning has been a huge problem. And by the way, it's not just in the direct COVID response. It was true about the algorithm for exam results. It's a structural government problem in general. The way that the tech sector goes about this is 180 degrees different to the way that government does it. They tend to publish their source code and have it kicked to pieces by experts in public, and then generally do a better job and obviously make trillions of dollars in the process. I'm not suggesting that's what our goal should be here, but it certainly leads to better outcomes, and that I think has been a huge problem. The second is having a proper definition of exit criteria, of moving from one circumstance to another. Setting a date seems to me very arbitrary. as opposed to setting a set of exit criteria, which we know when we meet. It also seems to me quite important from a motivational point of view, because if you say to people just wait till the 2nd of December and then it'll all be okay, that to me is a incentive to get away with as much as you can before that date. Whereas if you say to people, let's make sure deaths get to drop by some amount, drops by some amount, that actually encourages people to behave in the way that you want them to, rather than in the opposite. And the third is this point about a cost-benefit analysis. And indeed, I think Rob Denrick was reported, the community secretary was reported in the Times as saying that an impact assessment hadn't been made before the new lockdown measures were developed and introduced. And yet we have an entire field, experts of which on this call, that is designed to help us make these judgments. It's called health economics, and it's been a part of our policy making framework for decades. When I was a minister, I was responsible for NICE and medicines approval, and of course that is at the heart of how we go about judging what we should pay for medicines. And that there is a brutal fact, which lots of people, whether they say there are trade-offs or not, which is the way that we go about governing, and we do put a price on life in governing. The Treasury Green Book does it, and NICE does it, and we will pay certain amounts for certain drugs that do certain things, for example, in the kind of medical field. And it is important, I think. Now, that is a sort of reductive way of looking at it, and what all the participants so far have explained is that there are much more sophisticated ways of looking at it. But it seems no doubt to me that there needs to be some kind of analytical engine that is guiding policy in this way, because we need to know what our choices are. Now, in a crisis, I think there aren't any choices. If you feel the NHS is about to be overrun, I'm not sure you have many choices. And so this isn't actually read as an implicit, or shouldn't be read as an implicit criticism of government policy, but it is if you like, something of criticism about the process of policy making, because to give you an extremely crude calculation, we're probably going to spend or take on about 350 billion of debt this year in dealing with the crisis, and perhaps we will have saved 100,000 COVID lives as a consequence, maybe 3.5 years on average. So that means we were, like I say, very crudely, and I'm not saying this is correct, but something like we're paying about £1 million a QALY for those lives saved. By contrast, NICE will pay £50,000 a QALY for end-of-life drugs. And so at the very least, we want to be able to compare between lives saved through one route versus lives lost via other routes, whether that is stillborn babies or cancer deaths or people dying of heart attacks at home. And it does matter, because we do have different choices. There are other ways in which that money could be spent, and we need to understand what they are, or at least they could be, and we need to understand what they are. And just a final point about why I think this is necessary. There is a danger that this discussion, the debate about health v wealth, is settling into a sort of ideological or even sectarian kind of approach. And there's no need for that. It seems to me entirely plausible that everybody on this call and even attending could agree on what an analytical engine should look like, even if they disagree about what inputs should go into it. Some of those will be normative, some of those will be speculative, some of those will be factual, but we ought to be able to agree how we go about making those decisions, even if we disagree on our assumptions and therefore the outputs. And I would hope that out of this conversation, and Ian, you've already published in your excellent blog on the TBI website a first go at this, but I would like to think that we could do that, and that would actually be a huge service to better policy making.
Great, thanks, James. Yeah, and I completely agree. And for those of you who haven't seen it, I've got a downloadable spreadsheet that you can play around with on Medium and put in your own assumptions. It's nowhere near as sophisticated as anything Flavio would do, and he'd probably be shocked to see it, but it's good for policymakers to think through what the trade-offs are here and put in their own.
I've seen it actually, and it was quite nice.
Oh, thank you very much. Great. Okay, let's go, Martin, first to you, and then Chris, I'll come to you.
Thanks very much, and apologies for arriving late. I didn't catch everything at the beginning, so double apologies if I duplicate or just repeat what others have said, but I hope I won't. I just wanted to share a few reflections on this notion of trade-offs and integrating the different considerations. And of course, I agree with that. Trade-offs, we need to understand them, we need to manage them, we need to do cost-benefit analyses. But I want to think a little bit about what that translates into in public policy decision making and the public debate on public policy, on policy decisions, where it's translated into this notion of balance, which is all very sensible, right? You want to get the most health at the lowest economic cost. But it's deceptively sensible, I think. You can see how that justifies an incremental approach to tightening or lifting restrictions. You can see how that justifies doing a tiered approach. You can see how that justifies waiting for a national lockdown and so on. But there are some reasons why I think in this case that's not appropriate, and it leads us a bit astray, and it leads the public debate astray. Of course, in economics, normally we do think about interior solutions, right? We think about balance. We think about finding that tangent on the production possibility frontier, what you want to call it. But there are things about the pandemic and the epidemiology that makes me worry that that kind of sets the public defense of policies off on the wrong foot. So there are three non-linearities here that I worry a lot about. One is in terms of how the pandemic actually behaves. So one is at the level of test, trace, isolate capacity. If you have a low incidence of the disease, it's easy to keep R very low, certainly below 1, maybe even to 0. A sort of idealized TTI system, if incidence is below its capacity, within its capacity, you basically catch every infection, isolate everyone, you snuff it out every time, except for new imported cases, new index cases. But as soon as you're outside of that capacity, you start not catching everything and things start creeping up. So that's one non-linearity. The other non-linearity, obviously, is at health system capacity. There's a big difference when you still have some spare ICU beds and when you've run out of them. And that's when everything starts unraveling. And because of these two non-linearities, I've written before that we need to be a bit cautious about this notion of balance. And actually what you want to do is to choose a corner solution. Either you go outright for mitigation. You may not be aiming for herd immunity, but you aim to use all the health system capacity you have, fill up the ICU beds, but no more. Or you go for suppression, which in my definition is an incidence that's low enough, sufficiently within the capacity of test, trace, and isolate to basically keep R close to 0. Now, between those two, that's not really the proper debate, and from all I can tell, not the debate that's been happening inside government that we've really had. But I think that's what the economics tells us if we understand the epidemiology. And I say that as a non-epidemiologist, so I should really add some humility here, as I understand the epidemiology. But there's a third non-linearity that makes me think that the mitigation corner solution just doesn't work, and that leaves us with nothing but suppression. And that's the behavioral non-linearity. Several, actually, but there's quite a lot of evidence now, I think, that once incidence goes up to a certain level, people start shutting down the economy autonomously. And that's why you see this fall in activity, fall in footfall, even before lockdowns are imposed. People just get scared, they start pulling back, they start saving more, spending less, going out less, and so on. That changes what could be a sort of balance interior solution trade-off, right? It means that you kind of get the economic damage anyway, so you might as well lock down. So this sort of balance in the middle, I think, isn't really sustainable. And then, of course, we can add the non-linearity and political behavior. At some point, no politician can't live with a daily number of, in this country, 1,000 deaths a day. No matter what the economics says, that's just politically impossible, and people will have to be seen to act. So those are the ways I think this is a more complicated problem that the sort of very easy to explain economic problem is, and that has consequences. Everyone here understands that, but that has consequences for how this is communicated to the public and how the decisions are taken in a politically sustainable way.
That's great. Thank you, Martin. Really interesting.
Just one thing.
Go on very quickly, David. I want to get around to the others, but yeah, very quickly.
I didn't quite understand the logic of what you were saying. You were saying, well, these non-linearities must mean we get corner solutions. We can't have it's unlikely that what you call a balanced solution, which I think you meant by an interior solution, could be optimal. But then you described an interior solution. You said that we should, I think you said at some point, it may be that the optimal strategy is to suppress the infection rate such that the people who became infected and needed hospital treatment was in line with the capacity of the hospital system. That is an interior solution.
So it's a solution at the kink, to be technical, at that particular bit.
Yeah, right.
Yes, of course, you could do nothing. Fair enough. But I mean, it's two solutions. The beyond that is just politically inconceivable. But no, you're right. But those are the two solutions I have in mind. Yeah, but there are kinks, if you like, in there.
Yeah, there's lots of discontinuities, is the point, right? Chris, do you want to go next?
Sure. I think the Martin and James have neatly summarised some things I want to say, but I think the politics is part of the thing we've under stressed in this conversation. So I think it is under recognised that how terrifying Italy was in March. So a lot of I think what David's sort of counterfactuals are really hard to sort of think through, really, because we have no idea what the population response would have been to not the outbreak that we had, but the horrifying visceral images from Italy if they happened here. I think politics is also bears on James's point that we don't have a rules-based system. I mean, we don't have a sort of forward guidance basically for local government in particular, so that we can say we couldn't have said to Manchester, so the reason you're going into lockdown is ABC. We intend to unlock you when you reach X, Y, Z. And I think actually I would be an optimist about the ability of British people to sort of understand even that their city's situation might need different criteria to another city situation. Like, you don't have to be, blasé and monocultural about it. But the government's desire not to bind its own hand seems to be, as well as the lack of transparency, a sort of horse sense that whatever they must do, they must not pre-commit to things. It appears to be one of their binding sort of political considerations at the moment. We also haven't really experimented, and what I mean by that is that we had over the summer sort of 5 or 6 different parallel paths for lockdown, lots with different criteria. But as Flavio said, there are things you do in cities that we know probably basically costless. They probably don't really cause any spread, and we didn't really try to see, whether there are things that we could do differently. I think that the London experience of the 10 p.m. curfew is quite a good example of why the kind of thing I'd be thinking of, insofar as if that had been tried somewhere, and then they said, oh, hang on a minute, it means everyone turns up on the tube at 10 p.m. all in the same carriage. This isn't going to work. That level of just logistical thinking things through, even if we wouldn't have the case volume to do anything very advanced in the epidemiology, would have been helpful. I think we haven't really talked about distribution as well. So Tony and David have talked a lot about in aggregates, but one of the political difficulties of this is the distributional consequences are quite extreme. And I work in an industry that's being completely taken apart at the joints by the pandemic. Reliant on advertising, reliant on events. It's really horrifically brutal. That's what you've got to do. But it does explain some of the sorts of I think the growing politics at the moment. The other thing that I think has really emerged over the last 2 months is capacity as a conversation, and where there is capacity and where there isn't capacity. And one of the things I think you wouldn't have lost any money at this point in the pandemic betting against Whitehall delivery and betting on local government operational capacity. So local government has generally done well with the task that's been set. Hospital managers have done very well with the task they've been set. I'll put the Treasury aside so that to spare Tim's blushes, but the DH's capacity has proved to be pretty lousy, and I think there are good reasons for that. Not just the lack of money over a long time, but also the movement to an agency model, which meant that we have a government that doesn't actually keep a lot of people who know how a hospital runs in the middle of the government. If you'd gone back 20 years, the DH permanent secretary was literally a hospital manager, right? We had a different configuration of the state, and though there were problems with him, you know, I do think we have to, it is worth thinking about whether the modern civil service is fit for crisis.
Okay, thanks, Chris. Now, I'm conscious we haven't heard from Barry or Giles or Tim if you want to speak. So I want to give you guys a chance to come in if you'd like to before anybody else. So anybody, Barry, you wrote in the Times a piece about the cost and benefits. What's your reflections on hearing what people have said so far?
The issue I'd like to pick up is the one that a number of people have spoken to, and that is the time frame over which we're thinking about optimizing and choosing policy. I'm not sure yet we're thinking long enough, and that the concept of circuit breaker is just too easily been introduced into optimal policy design. It seems to me that we've got to think about the epidemiology of this problem and the likelihood that we're not going to get everybody vaccinated for at least a year. So we've got a year where we've got to decide what we need to be optimizing. And I'm thinking we're needing to minimize the loss of welfare that comes from the loss of QALYs and the loss of economic value over that period too. And, you know, there's been some great papers written in economics in the last 15 years that have pointed to how people value the health gains in the last 50 years just about as much as they value the improvement in the standard of living. So there's no scope here for missing out on either side of the equation. They both matter a lot to people. So what seems to me important is that we think over a 1-year horizon and not a 3-month horizon, which is where we seem to have got ourselves. I can't think of any particular reason at present why we're not going to see a continuation of these cycles of disease, up and down, until the vaccine arrives. There's sufficiently few people that are presently infected that we're nowhere near herd immunity. And I don't see that kind of bearing down on the dynamics. Now, if an epidemiologist are here, he might correct me, but having tested that thought on one earlier today, or somebody's pretty close to them, I didn't get any contradiction. So that's the broad framework we're in for the next year. And I think in that context, the sort of question I begin asking myself is, aren't there policies that we can commit to now that suppress transmission at fairly low economic cost, and which will enable us to do much softer touches on discrete breaks if we reach a peak? So we commit now to something. Now, the sort of thing that comes to mind is going back to a point that was raised earlier about self-isolation. A WHO expert wrote a very nice piece, I think in The Guardian this week, pointing out that what the big difference between us and Asia is that Asia takes self-isolation very seriously. It actually means something. They will punish you quite severely if you wander around having just been given a positive test. Now, if we commit for the next 12 months to, now how we go about it in a way that's socially acceptable deserves thought. But I would have thought some form of phoning up and checking to make sure that people have been found COVID positive, are actually at home, are actually there, and there is a risk that they will get punished in some fine or other, I suppose, if they're not there. Self-isolating is massively costly to the rest of society. So that would be one example. Another would be we only allow overseas travel for the next 12 months for work purposes or to see near family. It's not an option if you want to go on a holiday, a spree. There's lots of places in Britain, minimizes contact. What about committing to something like airport testing in a pretty thorough way? So people going overseas know they're going to be tested thoroughly when they come back. They'll be obliged to seriously self-isolate. There's certain cross-cutting policies that I think don't massively impact on our objective of sustaining economic life as well as good health, that we can take a 1-year commitment to, and that might enable us to reduce the uncertainty massive uncertainty that we've inflicted with this concept of circuit breaker that's almost built into our thinking about how to make policy. And I don't think it should be built in. That would be my first point.
Yeah.
Let me stop there.
Thank you, Barry. That's great. Giles, did you want to come in, or Tim?
Yeah, I mean, I've heard so many excellent points that I feel like I'm a sweeper who only needs to sort of catch up where something hasn't been said. I even wrote down non-linearity here, Martin. So thank you very much for making that point much better than I could have. I mean, one really fundamental point, I've been really impressed with the Treasury's attitude to how it fixes this. And I think partly because the Treasury, while acting incredibly short term in a way and rolling out programs at a speed that was staggering in March and April, it struck me they were thinking very long term in the sense that their original model was we mustn't allow this moment, whether it's a month, as we might have thought at the beginning, or 6 months, to destroy long term capacity. And the problem is the debate, if it's a 1 or 2 week thing, is really easy, what it means to not destroy long term capacity, which is just a pure shield and preserve thing, as it was when, you know, you have a snowy day or something like that, or a snowy week. Whereas the longer it goes on, the more you move into that terrible debate between whether protection means keeping things as they are, or protection means allowing the restructuring and reallocation of resources. And this is an incredibly difficult one. It's incredibly political, which is why I feel, I mean, I love models. And since Ian introduced me to the idea of putting in endogeneity and people's fear and everything, I've had lots of fun playing and trying to develop maxima and minima. But I know there's too much politics in here to have anything so precise as an ideal answer. And particularly when we're talking about what really matters is the long-term supply capacity of the economy as we come out of it. Both in this new COVID world, it won't be the same world as before, but keeping that going, in particular, avoiding mistakes like destroying human capital, destroying the educational assets of kids, keeping important company capital going. I know that the Treasury is thinking really interestingly and sensitively about what does it mean for companies to end up too indebted. Do some of the companies we're going to be relying on to lift us out of this, whenever that normal recovery can come, are they not going to be there anymore? And those costs are really hard to just estimate. And I suspect they're not, there are non-linearities. If you go too hard, you bend it until the spring doesn't spring back. There's going to be a lot of that going on. But I suspect that, you know, if you could trade an even steeper recession in April for an entirely clean exit that meant everyone could come out, nearly all of us would, and we wouldn't worry about whether we were minus 30% or minus 20% in that quarter. If we could have one single clean exit, if in one bound we could have gone to New Zealand, that would have been a great outcome, which is why I think it's very, very hard to just model this in a smooth, curvy, clever model-y way, because there's huge discontinuities between those kind of things. So I think if I was like an ignorant spad panicking in the middle again and trying to work out what I wanted advice for, I'd want directions of travel and broad advice, but precision I would be very, very suspicious about right now, because we're in a model-free world in a sense. Like as I noticed, Francis made a point. It must have been early March because I was still in. I remember where I was sitting. It wasn't a demand recession at first, and all the analysis around demand recessions went out the window. And in a sense, it doesn't matter that we had insufficient demand for, or whatever you call it when you stop people from spending for a month or two. What matters is what did it do to our long-term supply, and that means we really do need to have ways of understanding whether it's the restructuring or the preservation that we really need to be doing right now. And we need to be looking around the world. For example, I mean, I noticed the Economist is on a total tear examining how well the US seems to have done with the restructuring approach. It's a pretty unpleasant lesson. I mean, they've really mismanaged this COVID worse than our guys, I think. I don't really care what the figures say, but their basic attitude to the disease has been terrible at a federal level. And yet their economy is really quite strong. And I think we should be asking ourselves what it is about America that might have allowed it to outgrow Europe so well during this time. So those would be my big points, but they've been made much better than many other people. Yeah.
Thanks, Charles. Let me come to Flavia and then to Nancy. Flavia, I also wondered if you could address the question, like, you know, the kind of modeling that you're doing is, you know, very sophisticated and complicated, and it strikes me that, you know, the policy debate is so many light years away from really getting even the intuition of any of this stuff. But is there a danger that some of this work is just talking past the current debate, is not having the impact it needs to have, and what can we do about that?
So, well, I think that's absolutely true, but that's been true of economics for the past 50 years. that there's a disconnect between the sophistication of the analysis and the policy that is built on it, and maybe that's just unavoidable. Could I just make a small point and then draw some broader conclusions that we're going to go back to what Martin said and also what Francis said. The first one I just want to pick up was whether GDP was a bad or a good measure for the costs of lockdown. And I would like to emphatically state that I think it's a very bad measure, because many of the things that we value in life are non-market things. So when I go down to have a cup of coffee, of course, in GDP, the coffee transaction is going to show up, but my enjoyment of going for a walk and going down there and actually look at the birds and my fellow citizens, that's all part of being alive and being a human, and that's the thing we value. These things don't show up in GDP. Similarly, elderly people who might not be economically active, then might not actually be reflected properly in GDP statistics, because it's not like they're scaling back on their labor supply. So just to put that point to bed. Now, in terms of long-term thinking, I think we have, it is correct that the things I said about disease dynamics before were maybe not long-term, they were intermediate term thinking. One of the things that it seems to have been missed completely in the current debate are the really long-term things, like whether or not this disease is likely to be endemic. And the modeling, if you talk to epidemiologists, they is overwhelmingly pointing in that direction. That is, first of all, there is likely to be waning immunity. So that means that when we look at the infection fatality rates in the short run and try to do cost-benefit analysis, we might be doing a huge mistake. And the simple reason is that if everybody who gets infected and will get intermediate immunity for, say, a year, next year they're at the same risk, then basically we need to scale up what the actual risks of becoming infected. You can think of it as the grim reaper coming back every 1 or 2 years to have a new pick of the population. So that's the one thing, which is that immunity may be waning. The second thing is that even diseases for which we have permanent immunity, okay, so this is important, even diseases for which we have permanent and perfect immunity are still endemic, okay? And the reason is we have population growth. We have still people coming in because of birth, we have people that come from other countries and so forth. So that means even if you have permanent immunity, the disease may become endemic and we might have to live with it forever. Third point, vaccines is not going to radically save the day. First of all, vaccines are imperfect. Second, vaccine coverage is typically imperfect. And so we have actually many infectious diseases that are completely vaccine preventable and are still endemic. So I think we have to, to some extent, think about the really long run and try to see whether we can restructure our societies in a way that does not rely exclusively on mitigation and controlling the disease, but also change our mindset towards it as a way of looking at things where it becomes inevitable that once in a while we might have to close down schools, but we have to minimize the cost of doing those things. And that may well imply giving a laptop to every child so that at a day's notice, the schools can switch to online teaching. And that is a way of basically introducing the necessary measures of social distancing in order to control the disease, but at the same time minimize the costs that those unavoidable measures have on the disease. And the last thing, and then I will shut up. Martin's point about non-linearities, this is well taken. These models are very non-linear, and ironically, it's typically the linearities that give you corner solutions, not the non-linearities. But in the kind of analyses that I have been doing, that Tony is suggesting we do in an integrated manner, typically what you have is that you have different possibilities for the parameters. And for some parameters, it turns out that the optimal thing is indeed the corner solution. So for example, in my simulations, we play around with, how fast does immunity wane? And we find that if it wanes only in 1 year or in 2 years, then we get the interior nice balanced solution. But if it wanes, say, in 6 months, then the situation is much, much worse. And then complete eradication, which is a corner solution, actually emerges from the analysis as being the optimal policy. So it's not picking one or the other, it's doing the analysis and figure out when is the right thing to do one or the other.
Okay, thanks, Flavio. And some of those points, I think, speak to what Chris was saying about it's not too late for us to experiment on what works, and we're probably going to have to learn how to efficiently control this thing. Nancy, do you want to go next.
Yeah, I was going to actually pick up both a number of those points. So one is that this idea that the economic impacts aren't picked up in the health advice, and there will be. And if you hear the Chief Medical Officer and Chief Scientific Advisor speaking at the Parliamentary Science and Technology Committee this week, you heard him say that work is a health outcome, that poverty matters for health. That will be included. There is no doubt about it. What is interesting is where you hear them say it's not my evidence to publish. And that's interesting. Whose evidence is it to publish? The other one is where the Health Secretary is saying things like whether children are fed is not his policy. So that's an interesting one about where policy falls. And I think Jonathan was talking about it in relation to sick pay, about actually that's a DWP policy. So that we used to have a combined DHSS. So that's interesting as to how policy is made. I think Jonathan also made the point about why this kind of framework thing isn't useful for decision making now. And it's the opposite point to which Nick McPherson was making this morning, where he was saying this is only useful in a crisis. It's not useful for permanently. And actually, I think we don't know what's happening here. And therefore, you need to go back on principles. You need to build the evidence base from first principles. We have this broad data set, including all the things that actually make us have a life that's worthwhile, including a set of things about capitals, natural, environmental, natural, social, economic, and human. And so we should use this framework, this data bank, on which to build a framework for policy making, for both now in crisis and for the future of policy making as a whole.
Thanks, Nancy. Francis, did you want to say something?
Yeah, I wanted to pick up a couple of points. So really following on from what Flavia was saying about what I meant by long term. And that is that, you know, once you start recognizing that we're going to be having restrictions for a longer period of time, then you start having to look at the kind of long-term impacts that has on the economy. And I think that's where we are. When we had the first lockdown, I think there was this idea in policymaking circles that you could lock down for 3 months and then you would have suppressed the virus and you could reopen and get everything back to normal again, stick in a bit of demand stimulus, hence eat out to help out, and just get on with get back to where you were before, really. But I think that's not where we are. It's not what's going to happen, because the virus is with us and it doesn't go away that easily. And so things like Barry's idea that you could simply stop all non-business flights for a year have long-term consequences for the airline industry and for all the people who work in it. You know, Nancy's comment that, you know, was it Nancy's comment that my holiday is somebody else's job? You stop people going to Spain, and all the people who work in that industry, not only here but also in Spain, suddenly without work for a year or more. That is not something that can be regarded as a short-term effect. It has a long-run effect. It's a long-run scarring effect. There's a hysteresis implication there, and there are questions about sort of how our economy reforms itself and how those people reform themselves to find useful roles in a very, very different economy. And I don't think it's reasonable now, where we are now, to only look at short run and medium run effects and not consider these kinds of effects, because everything I've seen says that this is going to be an endemic problem, a problem that's going to be with us for 12 or 18 months or more, and that has long-term consequences for the economy as a whole and for individuals, families, households, businesses, whatever.
Okay, great. We've got about 8 minutes left, so we can have 3 or 4 more contributions. Tony, did you want to come in? I've been leaving you, ignoring you for a while, but it's probably time you.
Very kind. I posted a comment in the chat actually for everyone, but so I'll be very brief, which is just to point out that although it seems from the literature, and I feel too from the circumstantial evidence offered by the countries that have been most successful in this regard, that there is such a thing as a successful suppress, test and trace, wait for vaccine strategy. We haven't followed it so far. Maybe we will do, but that is not to say that it is not possible to overdo it. Too many negatives in that. So it is possible, obviously, to overdo lockdowns. One could suppress the virus very well with a 2-year lockdown, but in a lot of suffering and probably death too would be caused in the process of doing that. So the real question is how far in the region of this optimum is it nevertheless still the case that both health and wealth are both improved, and is it possible to get to that region either given the state structures you have or the politics you have? And that is a much more moot question.
Ian, can I make a plea for Tim, who's close to government on many of these things, to share his wisdom with us?
You can try.
You can try, but you won't be at all successful, because I'm not close to government, I'm in government. So I'm governed by all the restrictions on civil servants saying absolutely nothing interesting in public. So I can talk at length without saying anything, but that isn't really a very useful use of anyone's time. The only thing I'll assure people is earlier on, people talked about the short run, the medium term and the long run. And I promise you the Treasury is fully aware of long run implications as best we can be for the Treasury. We're not just about getting through the next week, the next month or the winter. We are concerned about the long term effects on the British economy.
Am I allowed to ask Jim one question to try and get something interesting?
Well,
actually, what you just said is this: is there some slight sense of frustration that the advice going to government is, in some sense, a bit unbalanced, in the sense that you've got SAGE with very, very learned people on it, focusing on the epidemiology and what you need to do to control the infection, and there is an asymmetry because there isn't the same level of advice going in on what you might call wider, and many of which are long-term costs of adopting certain strategies?
Civil servants are never frustrated. We know the deal when we go in and we stick to that deal.
Tim, do you know why the SAGE minutes suggested that there was such economic modelling going on, but then the Chancellor said there wasn't?
I do not know the answer to that question. That's the sort of question you're best off putting to the press office. I'm sure Olaf has a good answer.
Okay. Does anybody else want to come in? James, do you want to come in?
Yeah, and I'm sort of curious actually as to what your sort of goals are coming off the back of this discussion, right? Because it seems to me that there has been pretty wide agreement on two things. Firstly, there needs to be some much more sophisticated approach to cost benefit analysis informing policy than is currently the case. To what extent and how that might work against the advice that's coming currently, Tim is not revealing, but I think we can all get a sense that it is needed. And the second is about the way in which it's done. And I think this really matters because there is a trust problem. There is a big trust problem. It's not just untransparent modelling and decision making is probably not likely to be the best. It also is less trusted, so it's sort of flawed in two ways. So I was wondering whether the Institute or some other organization, coalition of people might try and tackle this from outside government, but in partnership with, obviously, ideally, but nevertheless to provide some outside impetus. So I was just keen to hear what your plans are on that front.
So I can't say that we have specific plans to actually to take on that challenge, but certainly with the kind of, not least starting with the model that I put together, I think there's a kind of basis there, hopefully, for people to project their own view of what's happening here or how we should think about it onto it. And I'd be very keen to get people's feedback on the extent to which this kind of thing is a useful policy tool. But I think just as far as today's concerned, I think it's been fantastic just to get out on the table all the different dimensions of this challenge. And I think the biggest barrier is not so much, to my mind, a lack of modelling, but a kind of what we shared today. I think I've heard so many new perspectives that I hadn't thought of, and I think there's perhaps a lack of understanding among all of us, lots of different aspects of this problem. We're all still struggling to get our heads around how this thing works. And I think one of the most important things we can contribute is continuing to host conversations like this, where people can further their understanding and bring different perspectives to bear. So I guess that's probably a pretty good point at which to draw us to a close. It's been a really fascinating discussion, and we will. I know that various places like the Treasury Committee and others are taking evidence and looking at this in more detail. So we will certainly mull over the contents of this discussion and think about what we can contribute to push the discussion forward. do stay in touch with us and let us know what you're doing on this front as well. And we'd be really keen to perhaps convene the discussion again in coming weeks or months as seems appropriate, if people would like to join in. Thank you to all the attendees who've listened in. I hope some of you got your questions picked up by the panel on the way through, but it's such an engaging discussion we couldn't go out to ask you them directly. But thank you, and thank you massively to our panelists, all of you, for joining this afternoon for such a fantastic discussion. And I will let everybody get back to CNN and find out what's happened while we've been talking about something else, and have a great weekend. Thank you.